So, welcome everybody to today's webinar on what switching to an Octopus meant for our glaucoma service with Dr. Jennifer Myers from the Wills Eye Glaucoma Service. My name is Monica Fischer. I am the market manager of perimetry at Haag-Streit in Switzerland, and I walk you through today's program. Before we start, let's look at how we can interact, or how you can interact with us. First of all, you're all muted, so if you have any questions, please use the Q&A button to post that question. And then after the session, there will be plenty of time for Dr. Myers to answer your questions. Don't use the chat function, as we will not be monitoring that in the same way. If you want to contact Haag-Streit, we've put a link into the chat, so you can use that link to interact with us directly. Please also note the meeting is recorded and will be broadcasted afterwards. We'll put it onto our YouTube channel. Though it's broadcasted, your personal information will not be displayed, so don't worry to ask your questions. And just before we start, I'd like to introduce some more resources on the topic of Octopus perimetry or perimetry in general. First of all, this is just the third program point of the Perimetry Focus Month. There are many more topics later in the month, so if you enjoy this meeting, check out the other ones. There are way more exciting talks to come. Also, if you want to go deeper into visual field testing, read up on some of the things we discussed today, there's two great resources, both based on the Visual Field Digest book. One is just the ebook as a PDF that you can download for free, and there's also a really great e-learning module. You can go through major points of that book. There's also quizzes. So it's a very interactive tool to learn more about visual field testing. Please look at the chat to see to get direct links to these resources. And now, before we start, it'd be great to learn more about yourself. So we have one little question, and that's really, what perimeter are you using right now, so that we kind of know a bit what you're working with and what your level of knowledge is. Just type if you haven't typed yet. Okay, let's look at what we have. Well, a lot of Octopus users, but also a lot of users of other devices. So let's move on to our actual talk today. It's my very great pleasure to introduce Dr. Jennifer Myers. He's a board-certified ophthalmologist and chief of the glaucoma service at the Wills Eye Hospital in Philadelphia. His central tenet as a physician is that each patient should determine, with the help of their physician, what is in their best interest among many treatments. So he really takes the time to interact with his patients. He's a respected lecturer on glaucoma diagnosis and management and has published extensively in the field. He's also active in clinical research, having participated in a